If you feel stuffed after a few bites, you're not imagining it. Bloating after small meals is usually less about too much food and more about what's happening inside your gut. Sometimes it's trapped gas, sometimes it's fluid shifts, and sometimes it's simply that your stomach and intestines are moving food more slowly than you expect. The tricky part is that many different causes can feel exactly the same from the outside. So the goal is to separate what's normal from what's a pattern worth investigating. Over the next few minutes, you'll get a clear mental checklist. We'll cover swallowing air, fermentation, constipation, food intolerances, hormones, and stress. You'll also hear a few practical self-checks you can try safely, like timing, portion structure, and symptom tracking. By the end, you should be able to point to the most likely category for you. Moving to slide 2. First, let's define what you mean by bloating, because that changes the likely cause. Some people mean visible distension. Your abdomen actually looks bigger. Others mean pressure, tightness, or a full up to the throat sensation. Gas tends to feel like expansion and shifting discomfort. Fluid-related bloating can feel puffy and heavy, sometimes later in the day. And slow emptying can feel like food just sits there, even when the portion was small. Timing matters too. If it happens within minutes, think air swallowing or stomach sensitivity. If it peaks a few hours later, fermentation in the intestines becomes more likely. If it's worst after several days, constipation patterns often show up. So before you change anything, get specific. What does it feel like? Where is it? And when does it start? Moving to slide 3. A surprisingly common cause is simply swallowing more air than you realize. This is called aerophagia, and it can happen with fast eating, talking while chewing, drinking through a straw, chewing gum, or even frequent sipping of carbonated drinks. Air takes up space immediately, so the bloating can start during the meal or right after. Some people also swallow air when they're anxious or when they're trying to hold in a burp. Another clue is frequent belching or a feeling of pressure high in the abdomen. The fix isn't complicated, but it is behavioral. Slow down, put utensils down between bites, take smaller sips, and check whether the bloat is worse on days with gum, fizzy drinks, or rushed meals. If the timeline is fast, this category should be near the top of your list. Moving to slide 4. Next is the traffic jam problem. Slow stomach emptying. Your stomach is supposed to grind food and release it gradually into the small intestine. If that process slows down, even a small meal can feel heavy and stuck. Common clues are early fullness, nausea, reflux-like sensations, or feeling full for hours. High-fat meals can slow emptying for anyone, and large amounts of fiber in one sitting can do it too, especially if you're not used to it. Stress can also shift your nervous system into a mode that prioritizes alertness over digestion. The practical takeaway is to test structure, not just quantity. Try smaller portions more often, moderate fat at one meal, and spread fiber across the day. If liquids feel easier than solids, that's another hint that emptying speed may be part of your pattern. Moving to slide 5. A huge driver of bloating is fermentation, your gut microbes breaking down certain carbohydrates and producing gas. This is normal biology, but some foods create more gas for some people. The big group here is often called FODMAPs, which are fermentable carbs found in foods like onions, garlic, wheat, certain fruits, and some dairy. If your bloating peaks 1 to 4 hours after eating and you notice gurgling or lots of gas, fermentation is a strong suspect. What makes this confusing is that healthy foods can be high fermentable, like beans and some vegetables. The goal isn't to fear food, it's to spot patterns. A simple experiment is to keep meals consistent and change one variable at a time, rather than cutting everything at once. If symptoms improve with lower fermentable swaps, you've learned something useful. Moving to slide 6. Bloating can also come from how your body handles lactose, fructose, or sugar alcohols. Lactose is the sugar in milk. If you don't have enough lactase enzyme, lactose pulls water into the gut and then gets fermented, creating both swelling and gas. Fructose malabsorption can do something similar, especially with large servings of certain fruits or sweeteners. And sugar alcohols, like sorbitol or xylitol, are famous for causing bloating because they're poorly absorbed for many people. The key clue is consistency. The same ingredient triggers the same outcome. Another clue is that symptoms often include urgent gas, cramping, or loose stools. Instead of guessing, look at the ingredient list and test a clean swap for a week. Lactose-free dairy, different sweeteners, or smaller fruit portions can be a clear, low-risk experiment. Moving to slide 7. Constipation is one of the most overlooked reasons small meals feel big. If stool is moving slowly, your intestines have less room to handle new food and gas. That creates pressure, distension, and that backed-up feeling even after a light meal. And constipation doesn't always mean you never go. You can have daily bowel movements and still be constipated if evacuation is incomplete or stool is hard and slow. Clues include straining, pellet-like stool, a sense of incomplete emptying, or bloating that builds across the day. Hydration, fiber, and movement all matter, but the balance is important. For some people, suddenly adding lots of fiber without enough fluid makes bloating worse. So think gradual changes and pay attention to whether your bloating improves after a complete bowel movement. Moving to slide 8. Another category is gut sensitivity, where normal amounts of gas or stretching feel uncomfortable. This is common in conditions like IBS, but you don't need a diagnosis to relate to it. The gut has nerves that report pressure and movement to the brain. In some people, that signaling is turned up, so the same meal produces more sensation. That's why two people can eat the same portion and one feels fine while the other feels bloated and tight. Stress, poor sleep, and anxiety can amplify that sensitivity. So can irregular eating patterns, because your gut gets less predictable input. The key clue is that symptoms don't always match visible distension. You may feel very bloated without looking much different. Approaches that calm the system, slower meals, consistent timing, and gentle movement often help more than extreme food restriction. Moving to slide 9. Let's talk about salt, carbs, and water retention, because not all bloat is gas. When you eat a salty meal, your body may hold more water temporarily to keep balance. Higher carb meals can also increase stored glycogen, and glycogen binds water. That can make your abdomen feel fuller or your midsection feel tight, even if digestion is fine. This type of bloating often feels more like swelling than pressure, and it may show up the next morning or later in the day. It's also common around hormonal shifts, which we'll get to next. The practical move here is observation. If your bloating correlates with very salty takeout, processed snacks, or big carb loads, consider spacing those foods differently and watching your overall hydration. The goal isn't 0 salt or 0 carbs. It's understanding your personal threshold. Moving to slide 10. Hormones can change bloating through fluid balance and gut motility. Many people notice bloating around the menstrual cycle, especially in the days before bleeding starts. Shifts in estrogen and progesterone can influence how the body retains water, and they can also affect how quickly the intestines move. That means you can get both water-related swelling and constipation-like slowdown at the same time. Menopause transitions can also change digestion patterns for some people, partly through sleep and stress effects as well. The helpful part is predictability. If your bloating follows a monthly rhythm, that's valuable information, not a mystery. Track symptoms for 2 or 3 cycles and look for repeatable timing. Then you can plan meals and habits around your sensitive window, like keeping fiber steady, prioritizing hydration, and avoiding your biggest gas triggers during that phase. Moving to slide 11. Stress deserves its own slide because it affects bloating in 2 directions at once. First, stress can change motility. Some people slow down and get constipated, others speed up and get urgency. Second, stress changes breathing patterns. Shallow, chest-heavy breathing can increase air swallowing and keep the abdominal wall tense. There's also the brain-gut connection. When your nervous system is on high alert, normal sensations can feel louder. If your bloating is worse on work days, after conflict, or when you eat while multitasking, this is a strong clue. A practical test is to create 1 low-stress meal each day. Sit down, chew thoroughly, and breathe slowly through your nose between bites. You're not trying to be perfect. You're testing whether your nervous system state is a major lever for your symptoms. Moving to slide 12. Now let's cover a common mismatch. You feel bloated, but the main issue is reflux or upper GI irritation. When the valve between the stomach and esophagus is sensitive, gas and pressure can build high in the abdomen and chest. That can feel like fullness after a small meal, frequent burping, or a need to loosen your waistband even though the meal was light. Certain triggers are common. Large meals, high fat, chocolate, peppermint, alcohol, and lying down soon after eating. Another factor is meal timing. Late meals can increase symptoms simply because gravity isn't helping. The goal here is not to self-diagnose, but to recognize the pattern. If your discomfort is mostly upper abdomen with burning or sour taste, it's worth discussing with a clinician. And as a self-check, note whether staying upright after meals changes the sensation. Moving to slide 13. So how do you narrow this down without spiraling into food fear? Use a simple 3-part log for 1 week. First, timing. Note when bloating starts. Immediate, 1 hour, or 3 hours later. Second, location. Upper abdomen points more toward air swallowing, reflux, or slow emptying. Lower abdomen, especially later, points more toward fermentation or constipation. Third, the output clues. Gas, stool changes, or water puffiness. Then run one experiment at a time. For example, slow your eating for 7 days without changing foods, or remove carbonated drinks only, or keep fiber steady but add a consistent walk after meals. This is how you learn what actually moves the needle. If you change 5 things at once, you'll never know what helped. The goal is not perfection. It's a clear signal from your body. Moving to slide 14. Finally, let's cover when bloating should be checked more urgently. If bloating is new and persistent, progressively worsening, or paired with red flags like unexplained weight loss, persistent vomiting, blood in stool, severe pain, fever, or trouble swallowing, it's worth getting medical help promptly. Also, pay attention if you're waking at night with symptoms, or if your abdomen becomes hard and very distended. Most bloating is functional and manageable, but it's not your job to guess when something needs evaluation. On the practical side, bring your 1-week log. Clinicians make better decisions with specifics, timing, triggers, bowel patterns, and what you already tried. Before we wrap up, here's one question for you. Do your symptoms start mostly right away, or mostly a few hours later? Leave immediate or delayed in the comments. And if you want more clear, calm breakdowns like this, subscribe. Fix the metabolism, not just the symptoms.